Okay, now we're going to talk about a more advanced rehab protocol in the posture doc rehabilitation series. These are the cervical and lumbar fulcrum exercises. That's the cervical, and this is the lumbar. Very lightweight, but a very, very dense material, and it will not break down. Previous versions, especially with people with larger torsos, they would break down very, very rapidly. The softer foams can be used in the beginning stages of rehabilitation, but will not be very effective in the long range. These are very uniquely designed. This is my design, and they are pyramidal in shape here with a flat top, and it has a core of the same material, tubular core, that only extends about 4 inches, 4.5 inches inward from the ends, so that the center is hollow in that core, so that the lumbar spine can, and the spinous processes can yield and not be pressed on too difficultly or too firmly, and this will actually cradle the paraspinal muscles and on the lumbar spine. And it has a material on the bottom that helps you to not slide around. The cervical fulcrum is designed in such a way that it's an incline and with a very straight front. It is cradled to fit the cervical spine over it like this. And as I say, this should go up against the shoulders tightly, and the head should be in a position so tightly that it rolls down the hill and elongates the cervical spine, creates a traction effect. So we'll position them right on the floor when I get on them, and then we'll start to do the exercise protocols from the beginning up to the advanced. So we'll start with the lumbar fulcrum in place, and the lumbar fulcrum will be put in such a way that the top of the hip bones, put the thumb on the top of the hip bones, and put the fingers down on the floor, and that's where the bottom of the fulcrum goes, so that this would be right in line like this with the crest of the ilia. And that would be the exact correct position for every individual. Now when you lie on it, you're going to see exactly what you're witnessing and what I'm experiencing. If the spine isn't fully warmed up, the pelvis will not go down to the floor. There'll be a gap underneath. And you'll see how that is managed in just a moment. Don't force it. To the degree that you're comfortable with it, let the pelvis go down and let the tissue start to stretch a little bit. Then you take the cervical fulcrum, lift the head, put the cervical fulcrum very, very tight against the shoulders, and let the head roll down the hill. So then the fulcrums are placed in the correct position, equilateral, and we can just simply start to relax. Okay. So the first motion in the lumbar spine, again, just let yourself relax on it to the degree that you can be comfortable. If you cannot let the hips go all the way down, slightly contract them so that you can handle it, if you will. And so the first motion on the hips would be side to side, like this here. So you swing the pelvis, swing the pelvis. Notice the position of the feet, similar to the wobble seat. They should be a little bit far apart to create a tripod effect. So we'd swing the hips, swing the hips, swing the hips, swing the hips, swing the hips. And we do that quite a number of times. Truthfully, I like to do it about 100 reps, and it doesn't take very long. It takes 100 seconds. 1001, 1002, 1003, 1004, 1005. So it doesn't take a long time. The next range of motion, and again, we're going to focus on the lumbar spine to begin with, would be raising the pelvis up and down, up and down, up and down. Now, many people are going to feel uncomfortable when we first start to do this because, as I said, this is an advanced protocol. So again, upward as much as you can, downward as much as you can do without too much discomfort, and you control the motion to your tolerance. But you're going to see that as you continue to do it, your hips will go down lower, your hips will go down lower, your hips go down lower, and then you'll see that the gap underneath your hips are completely gone and your hips are on the floor. And so then the next motion on the pelvis would be trying to draw a circle and imagine a clock on the wall over there, and you're going clockwise around an arc of motion, again functioning off the pivot point in the lumbar spine. Then you go a number of repetitions counterclockwise. And if you cannot do the head and neck in concert with the hips, just do one section at a time, as I'm doing right now, putting all my attention on hip motion and hardly any attention at all on the neck. So now in the neck protocol, we would again put the block tight up against the shoulders, the head's rolling down the hill, and the neck is cradled in that notch. We would again start by doing side bending, side bending, side bending. One of the most difficult things that the patients experience when they're doing this is they want to roll and roll and roll, because as we lose function in the spine, the cervical spine is the predominant area of first loss, and we lose our ability to laterally flex, keeping the chin in midline. So sometimes I tell the patients, pray while you're doing it that you're doing it correctly and having the ideal effect. Put your fingertips on your chin, and to control the chin remaining in midline like this. When that happens properly, the head is sliding across the fulcrum like this here. So that's the first plane of motion for the neck. The neck then would have to go through rotation motions like this here. Look at the floor, 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 and stretch it obviously at the end points so that you can get a more ideal effect. Now the third motion of the cervical spine is chin tucks. And in an ideal scene, the tongue should be on the frenulum through all of these exercises. The tongue is, the frenulum is a flap of tissue underneath your lip on the front of your upper teeth, and the tongue should go over the teeth up onto that frenulum. And we would always tend to have an upward gaze so that the fulcrum is very, very tight against the shoulder and the head is rolling downward. So the third exercise, tuck, tuck. You're not lifting off the block. In fact is, you should encourage full weight on the block and compression on the block while the chin goes into flexion. And think of more of bringing the chin into the Adam's apple first, and then getting the back of the head off the block, but not the neck off the block. So now, if we get to the more advanced phase of this, then we would be able to do the lower back and the neck exercise in harmony, in sync. You would have a much, much, much more profound effect. So the first motion would be flexion extension. I'm going to change that though. I'm going to say that this first motion should be side bending. And we can cut here. The first motion that should be done.
Start that over again, just first motion.
Okay. The first motion that should be done is side bending. And so then the last motion should be tucking. That's more difficult, so we'll keep that as the last motion. The first motion, if we're doing the head and neck in sync, we would bend the head, sliding the head on the fulcrum, and then having the hips swing to the same side that the head is bending. Again, tongue in the frenulum, and with the upward gaze to the degree that you can tolerate. After you start to do this a number of repetitions, again, I suggest 30 to 60, then what happens is you'll see that you're down on the floor in pretty good shape. Now the next motion, we probably want to put the hands a little bit out to the sides, and you're going to turn the head and look at the floor. Again, more upward and upward rather than straight sideways. But notice that I'm turning the head, but I'm still swinging the hips, because you cannot turn the hips while you're doing the head. And if you ever did do that, you would start to fall off the block, so that wouldn't be an ideal situation. So hips swing side to side, head turns side to side in the second plane of motion. In the third plane of motion, we would chin tuck and raise the hips. So as the hips come up, the head comes up, the hips go down, and the head goes down, just like that. By this time, you're starting to re-establish and encourage ideal relationship to the pivot point in the lumbar spine and in the cervical spine, so the spine will start to become much more easy through its range of motion. So the third one will be circles. Now this one, with the head and neck and the pelvis, they'll go in harmony very well when they have decent function. They cannot go in harmony when there's too much pathology in the spinal system. So many people will have a lot of difficulty with this. And again, we're going to go as though we had a clock above us and a clock below us. And so I'll start with clockwise in the hips and clockwise with the imaginary central rod coming out of the head, drawing the circle around the clock. "30 to 60, 30 to 60. Now by this time, the spine is really thoroughly warmed up and yielding to the pivot points in the curve and the neck and in the lumbar spine. And there is quite a lot of traction effect taking place on the spine, so it is not like it is perfectly comfortable and one could fall asleep like this. There's still a good amount of strain on the tissue. Remember, this is a more advanced rehab protocol.